Hello, everyone. The topic that I will be discussing today is the need for access to affordable healthcare. The thesis that I will be arguing is that for the betterment of itself and its people, the state should provide equal access to affordable healthcare. And for some context, when I say the state, I'm referring to the governing body of a population, whether that be a country, prefecture, actual state, or anything of that nature. And to background before we get into the actual argument, in the United States alone, residents spend over $12,000 on medical care on average per year. And nearly 40% of United States residents reported avoiding receiving treatment out of fear of cost alone. This percentage also does not include mental health or emotional treatment, so in reality, that number is much higher. The United States is one of many places that does not provide access to affordable healthcare to its citizens across the country, and this makes its residents have to ignore their well being and have to miss out on various things due to being sick, injured, or mentally unwell. My first premise is that access to affordable healthcare allows residents to have options for types of treatments that they need to stay healthy. By having this access, a person who would need treatment for an illness could go and get it. Somebody who needs treatment for mental ailments could go and get it. If somebody's injured, they can go and get treatment as well, and much more. Since the population would finally not only have access to healthcare, but affordable options as well, people could finally get the treatments that they need and even have better options for their treatments than before, since now they would be at a more affordable cost. My second premise is that by providing this access to affordable healthcare, the state would actually benefit, as it would then be able to function at or closer to its maximum efficiency, leading to a better economy as well. The public as a whole would be able to work better since they would not have to spend so much time being sick or injured, as this access would allow them to go and get treatment as soon as they have the time and, in turn, return to work. These treatments would include mental health treatments such as therapy and access to psychologists, and people would be able to take care of their mental health, which is greatly ignored, and in turn become less stressed and possibly happier. And while that sounds very idyllic, talking therapy alone has shown positive results in helping those facing depression, anxiety, eating disorders, and much more. One possible counterclaim I'd like to discuss is the claim that the state would not function better by providing access to affordable healthcare. Some people believe that just by having affordable healthcare options for communities does not mean that the state would be able to function better or gain anything or have a better economy. However, access to affordable healthcare leads to more healthier and able bodied people. This option of being able to go and get treatment and return to work quickly would increase the state's labor supply, leading to a better and even more stable economy. And on the topic of economy and businesses, this movement would also mean that more medical providers would need to open up businesses in areas that are currently medical deserts. A medical desert is an area that does not have medical care options for its residents in its vicinity, and these are typically found in areas with low income populations. Since the providers would need to open up businesses in these areas, it would bring in more traffic, other businesses, and even help the area develop. Lack of access to affordable healthcare is becoming a much more prominent issue as time goes on, and we face things such as pandemics, worsening antibiotic resistance, bacterial and viral mutations, and more. By providing equal access to affordable healthcare, people wouldn't have to put aside their ailments and have to wait for their payday to get treated. We would be able to move forward with a population that is healthier and happier.